You'll notice a little fluid on your knee or swelling, edema. You'll have some heat or redness and pain. And like you said, there's an unknown origin of what caused it. And that's part of the whole, we're using it as a shock absorber. So every day you have the potential to create a trauma to the body. By stimulating different points in the body, we're going to promote blood flow or activate the circulatory system to bring nutrient-rich blood to the area, which will bring in healing nutrients. You're also activating the lymphatic system or the immune response in the knee, which will also take out the bad or damaged tissue.
In physical therapy, you're working very hard to improve and reset the musculature around the knee. You're improving flexibility, you're working on balance, but you're not doing anything specifically to really initiate a healing response. All right, welcome back to another edition of our Collaborating with High Quality Healthcare Practitioners. And remember that if you are here, just start us off with a like, a comment, share this if you know people that are interested in acupuncture. And especially in this case, we're going to be talking about knee pain. So we'll get into that in a minute, but I'm super excited to introduce Matthew Beeman, who is the newest acupuncturist that has joined our Boonsboro office. And he is a fantastic practitioner who trained with some excellent orthopedic specialists and has kind of a subspecialty in orthopedics. So we thought talking a little bit about knee pain and specifically getting into some of the structures and the meniscus is where we're gonna take this talk today. So Matt, super excited to have you here.
Thank you. Glad to be here.
Yeah, absolutely. So let's get right into it. So we're talking about knee pain, and will you give us kind of like, for those people that are watching, just a little overview of the knee, and kind of we'll get into what why acupuncture is helpful for knee pain, and then we'll go into kind of what are the types of treatment that we might do on somebody with knee pain, and especially when it comes to the meniscus. So can you kind of orient us to the meniscus and just the knee in general to start, and then we'll go from there?
Yeah, so the knee joint to me is probably one of the most fascinating joints in the body. It's so complex. It's one of the probably the largest joint in the body. Think about it. You have your femur and your tibia, so your thigh bone and your shin bone, and they meet, and that kind of creates the knee joint. You have a couple articulations in there, the tib and the femur, like I just said. Then you also have the patella, which is the little sesamoid bone on top of the knee. It articulates or glides with the femur. And those two bones, as well as the fibula on the side, that's the smaller bone on your shin, they all kind of combine and create the knee joint. You also have a lot of ligaments, tendons, cartilage in there. And that's kind of where people typically will have pain and injuries occur. So most people have heard of the ACL and the PCL, which are your anterior and posterior cruciate ligaments. That kind of allows your knee to go forward and backward, but not too far. And you have the MCL and the LCL, which is your medial and lateral collateral ligaments. And that allows your knee to go side to side. And again, not too far, because if it goes too far, you're going to have an injury. Inside of there, you have two little semilunar structures. They're called the meniscus, which we'll talk much further about throughout this. But they kind of give a nice gliding area inside of the knee joint that allows the knee to be a shock absorber. And they oftentimes will get injured throughout our life. As you get older, you've been walking, so it's shock absorber. It kind of degenerates over time. Or when you're young or playing sports or pivoting outside, walking on the sidewalk and go from the sidewalk to the grass, you can have a shearing force that will then create an injury to the meniscus.
Yeah, and it's one of those things that a lot of times, something that we see that I'm curious if you do also is a lot of times meniscus injuries come without a real solid origin, meaning like people will come in and they'll just say, my knee started hurting, I don't know why, and I didn't really do anything. I didn't have some major injury, and that, and then come to find out, that they ended up having some sort of issue with the meniscus, either, a shearing or a fraying or something has happened there. Is that something that you see a lot of as well?
All the time. Patients will come in and, you'll notice a little fluid on your knee or swelling, edema. You'll have some heat or redness and pain. And like you said, there's an unknown origin of what caused it. And that's part of the whole, we're using it as a shock absorber. So every day you have the potential to create a trauma to the body, but typically that doesn't happen. But you see it often. I mean, 5 to 10 patients in a week, you're going to have someone who has knee pain.
Yeah, absolutely. So go into a little bit about why, everybody who has knee pain, whether you're an athlete or just somebody who has, been a runner in your previous, different points in your life, or whether you just kind of like Matt said, stepped funny off of a curb. Why would somebody go to an acupuncturist over or in addition to something like physical therapy or an athletic trainer or some other therapist? We hear about it a lot with physical therapy, but as we see tons of people with knee pain. So talk a little bit about why acupuncture would be beneficial in addition to or in lieu of some of these other modalities.
Yeah, I think acupuncture is great to use in conjunction with other modalities, PT, athletic trainers, any type of therapist. So what we do is we kind of activate the body's innate healing ability. So by stimulating different points in the body, we're going to promote blood flow or activate the circulatory system to bring nutrient-rich blood to the area, which will bring in healing nutrients. You're also activating the lymphatic system or the immune response in the knee, which will also take out the bad or damaged tissue. So two main things there: you're bringing in good blood flow, and then you're taking out all the bad damaged tissue. And you're also going to activate the nervous system, which then goes there to reduce pain and inflammation in the body.
Yeah, it's great. It's a really important distinction that you're making between, in physical therapy, you're working very hard to improve and reset the musculature around the knee. You're improving flexibility, you're working on balance, but you're not doing anything specifically to really initiate a healing response. And so often what we see is people who come in, and obviously we're super big supporters of physical therapy. We have lots of friends in physical therapy. We want people to do physical therapy, but sometimes you get a lot of strength and improved balance, but you haven't really addressed the underlying issue. And one of the things that acupuncture is so good at is exactly what Matt just said, which is really clearing out some of the damaged tissue and replacing that with nutrient-rich blood to literally heal the tissue itself. And this is something that, in theory, the body should be able to do itself. But as we all know, between injuries and inflammation and, diet and, all the different things, chemicals that our body's exposed to, it's much harder. And sometimes you need a boost. Your body needs something to get it over the hump. And I think that's what you're referring to.
Yeah, we sometimes just put a couple needles around the knee joint, and we're going to tell the body, hey, this is what we need you to do. Another interesting to continue about talking about the knee joint, it is a hinge joint. So in theory, it's a modified hinge joint. A hinge joint should flex and extend. The knee is modified because it has a little bit of internal and external rotation, which allows an athlete or anybody to be able to pivot and push off and go side to side. And this, to talk about meniscal injuries further, you have a couple different types of injuries that occur. So you can have a radial tear, which is kind of, like I said, it's a C-shaped fiber cartilage in your knee. So a radial tear goes into the cartilage, but not along it. Then you have a horizontal, which goes along it. And that's a really beneficial one for acupuncture to treat because it's a vascular area. So by tearing the vascular portion of that ligament, we promote the blood flow to it. It can heal a lot better. Then you also have a couple that are a little bit harder to treat and may require surgical intervention. And that's a bucket handle tear, and it looks just like it sounds. It's a bucket, and it kind of pulls away. That causes your knee to kind of get stuck, and that sometimes requires surgery to cut that tissue off. And same thing with a flap tear. It flaps in and out of the joint. It can create your knee to get stuck, or like a lock when you're going down the steps and it doesn't want to fully extend. And then 30 seconds later, your knee's back to normal. It's because that kind of tissue flapped in and out of the joint.
Yeah. Interesting. So, So many times, what we'll see is, it could be any one of these kinds of tears, and there's different grades to them as well, right? I mean, you can have minor versions of things that we may be able to repair just by helping the body to improve its own healing process, and then you have more severe versions like the bucket tear, for example, where the likelihood is there's going to be some sort of procedure that's needed in that case. Is that accurate?
Yeah, and then the other important thing is if you do have to go down the route to get a surgery to fix the injury, we can help promote the body's healing post surgery.
Mm-hmm.
So you can come to us after you've already had the surgery to help recover. And all we're going to do is, again, we're going to promote blood flow to the area and bring those healing properties to, say it's a 6 months recovery, which a meniscus it varies depending on the severity. But the likelihood, if you implement acupuncture, internal herbs, topical liniments, you're going to expedite the healing process and get back to action a little bit sooner rather than bypassing it.
Yeah, it's one of the things that I think speaks to what you were describing before, which is using it in conjunction with other medical professionals and with other modalities. Even surgery, it's so valuable to get your body healing after a surgery and to boost your body's natural ability to get better faster, because what it does is it's retraining. It's literally training the way that your body's going to respond in the future to other issues that might come up. And so it is so valuable to incorporate this when you're going through a surgical procedure as well. So yeah, fantastic. What about what to expect? So if somebody is coming in and they've got this knee issue, they've got either a meniscus tear, or they've just got this knee swelling like you were describing before, inflammation, redness, what can they expect? What are some of the things that you might do to them that might help, and what kind of maybe to take it a step further, what kind of how long will somebody expect to be involved? So let's take those separately. First one is, okay, what can you expect in the treatment room if you're coming in for acupuncture? And then we'll get into kind of like how long and what that might look like.
Yeah, so when you come in, just say you have had no imaging at all and you just, I got some swelling to my knee, it's discomfort. You're going to get a complete detailed intake, and that's often going to require, I'm going to do some range of motion, passive and active, to see, okay, are we getting that full extension? Are we getting the full flexion? See where there's a pain, if there's no pain. You also undergo some orthopedic tests, and I like to do 3 tests per joint. So if you have carpal tunnel, or you have a rotator cuff injury, or a vertebrae issue, I like to do at least 3 tests to test the area, because if one's positive, you might have an issue, but if I do 3 and only one's positive, it might just be regular wear and tear on the body. But if you have 2 or 3 positives, likely there's something going on, and then I can really make my treatment precise for what's going on. Instead of just guessing in the general location, we know what's going on at that point. It's kind of a differential diagnosis of sorts. Without imaging, I can't see what's going on the inside, but I can get a pretty good guess going on with a couple orthopedic tests. So then the further that we would continue to talk about, your treatment, different topicals we can put on, internal herbs, in your likelihood, you're going to undergo acupuncture. Obviously, you're coming for acupuncture. So you get some points around the knee. You get points a little distal from it as well, which will promote different parts of the body's healing to activate, again, the circulatory system, the nervous system, and the lymphatic system. Most likely, you'll get electric stimulation on the knee, because it's been proven to regenerate cartilage quicker. And all that is the acupuncture point would go to the knee, and I attach these little clips to it, which produce a mild microcurrent that goes onto the needle. And it's almost like a TENS unit, which is superficial, but we are deeper into the muscle, which helps create that healing properties a lot quicker. Then you also get nutritional advice. There's a lot of natural food you can eat that promotes the anti-inflammatory. You'll also get internal plant-based supplements that help promote the healing in the body. And likely you'll get a pain spray that we put on top of it, which then it also will help regenerate cartilage and tissue and ligament and reduce the pain and the swelling, all the good stuff that you want when you come to get treated.
Yeah, fantastic. So, the name of the game is that you need multiple tools to build to rebuild the house, right? So, you're adding in addition to everybody knows acupuncture means that you're going to get some needles in your body, and that those are going to help stimulate the healing process. But also, like you said, you've got acupuncture, so you've got the needles, you've got the electrostim, which, like you said, has been proven to speed up cartilage repair. You've got the internal plant-based supplement, which is there to help improve blood flow to the lower body specifically. And we have different formulas that target different parts of the body. And then you have that topical that, is for pain, but it's also for tissue repair itself. It comes through that martial arts lineage, and we're able to, so you've got 4 different things there, plus nutrition, which is a huge piece of this, anti-inflammatory foods and things that can help your body to recover faster. So immediately within, the first couple of treatments, you're going to have 5 different tools that are going towards this particular repair mechanism, which is awesome. Yeah.
And likely you'll have 6 tools, because you'll get light stretching and ways to also strengthen your knee joint. And if you're going to a physical therapist as well, you've probably already heard these, but we'll reiterate it, and you'll know the importance of doing your homework when you're at home to strengthen that knee joint as well.
Yeah. Very good.
Okay. I think you asked another question about length, like how long it's going to take. That might be where you were going with that.
That's it. Yeah. Go for it. Jump right in.
Everybody's different. Every injury is different. I mean, if it could be a real acute injury that, you just tweaked your knee, there's no real swelling or heat, it's just a little discomfort, those could be really quick. It could be 2 to 4 treatments and have a marked improvement. But then you have more, okay, I'm in my 50s and 60s and my knee's really hurting. It's several years that this has been going on. Likelihood you're going to be looking at a longer treatment plan. It could be 10 at first, and then we kind of taper it down to weekly. And, you're going to notice an improvement over the first couple visits, but then we want to have sustained improvements. So you're looking, if it's very, very minor, probably 4 to 6, and then follow up from there and see if you need just regular maintenance. And if it's more chronic issue, you're looking 2-3 months where we're doing regular treatments to get you back to. I had a patient the other day said they wanted to lose 10 years off their knees. They were in their 70s. They wanted to get back to their 60s. So we have a process for it. And he told me he lost 10 years in 4 weeks. So.
Wow. That's awesome. Yeah. And it is interesting, there's so many different ranges, like you said, of how somebody responds. So we see everything from, a super fast responder to somebody that has had something for a very long time, and it does take a little bit longer. And that's why I think your range makes a lot of sense. It could be anywhere from 3 to 4 weeks, all the way up to anywhere to 3 to 6 months, as far as working on something like this. And the other thing I think that's important is that we talk, in terms of the phases of what people expect. So you were kind of alluding to that first phase, which is really the acute kind of corrective care, getting the body to just feel better, just start to get some movement, that gets, and what happens with a lot of people is they go, oh, I'm feeling better, and they kind of drop off. But that's where the real meat and potatoes is, because once you start feeling better, your body has been signaled, but now it's that compounding effect of getting to the point where your body is literally getting stronger in that area, and that healing process is going on. And so then once we get there, now, so that's what we call stabilization. So under stress, in whether it be physical or emotional, you're not just reverting or regressing back, right? We want to stabilize the gains that you got in those first few weeks. And then from there, once that's in place, and we know, okay, you've tested it, you've been under stress, you've played some sports, you've done some exercise. Now we move you into what we call a wellness phase, which is, less frequency, more about maintaining the gains and continuing to get stronger with very little care. It's like once the train's on the tracks, and moving, you can keep it rolling.
Yeah, and everything you just said, when you come to see me or any other practitioner, you're going to get a piece of paper that lays this out for you. Hey, I want to see you twice a week for 3 to 4 weeks. And then that's your acute phase. Then, hey, I want to see you once a week for 6 to 8 weeks. There's your stabilization. And then it's maintenance. It's kind of up to you. I want to see you once a month. If you need me, I'm here. And if you don't, I'll see you in a month.
Sounds good. Perfect. Well, this is awesome. I think this gives everybody who's watching a real good picture of, not just kind of what's going on with that swollen, painful knee, most likely, or in a lot of cases, but also then what you can expect from acupuncture, and then, what you can expect as far as how long it will take. And that's really what we wanted to make sure to convey with this video. Is there anything else that you think is important to add here at the end?
Yeah, with the knee, I know we focused majority on the meniscus, but again, go back to the very beginning of this. I talked about other structures in the knee. You have your ACL and your PCL, MCL, LCL. If any of those are injured, or osteoarthritis, or you're just having knee pain in general, they all can be addressed with acupuncture. It's all going to be similar treatment style, but we'll address it to the patient specific depending on what's going on. And we can even go further than just the knee. There's tons of joints in the body, 610 muscles, 206 bones. There's a ton of spots we can treat. So not just the meniscus, but you name it: shoulder, back, wrist, elbow.
Spoken like a true orthopedic acupuncturist there, sir. Very good. That's awesome. No, fantastic. Really appreciate that. If you guys want to check Matt out, you can see his bio on our website at hhamd.com, and go to the About page, and you'll be able to check out our practitioners. Matt's working out of our Boonsboro office, and really doing some great work there, not just on the orthopedic side, but that was our area of focus for today, and that's really a great special subspecialty of his. So hope you guys enjoyed it. Give us a like if you did. Give us a little comment. Let us know what you think about the meniscus and your knee in general, and make sure you share this with anybody that may be a good somebody that could really benefit from getting some care, and we really appreciate it. So thank you, Matt, for being here and sharing the knowledge.
Of course, thanks for having me, and hope to see some viewers out there in Boonsboro.
Absolutely. Thanks, everybody. Take care.